The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. We're kicking off year 2 of the podcast with quite a bang. We've got Dr. Will Flanary here. He's an ophthalmologist, a doctor of face balls, if you will. You might know him. You might know him better as Dr. Glaucomflecken on TikTok and all social media. He's got just about, probably when this airs, 2 million TikTok followers, over 500,000 subscribers and followers on YouTube and Twitter. So kind of a big deal.
Thanks for having me. Happy to be here.
So among all those accolades that you have, the one that we have in common that's relevant to this podcast is that you are a testicular cancer survivor.
That's right. Had it a couple different times. So the first time was way back in med school. It's been, what year is that? Was like 2011, I think.
Oh, wow. So it seems like this is a disease that happens to people when they're in their prime of their life. I mean, med school, that's a big deal.
Yeah, it was, obviously it comes out of nowhere. Whenever you're young and you have cancer, it's like the last thing you ever think is going to happen to you, right? You have this sense of invincibility whenever you're in your 20s, and then all of a sudden you have this disease that you associate with people who are 3 times your age. So it's a tough pill to swallow. And so it's, fortunately I had a lot of good people around me. I was I was married at the time, and actually we had a kid at the time too, which made it a little bit easier, but also a little harder, to kind of face that new challenge in life.
Yeah. Take me back to when you were diagnosed, having a kid, being in med school. I mean, those are already things that are very stressing.
Yeah. Fortunately, I knew enough of medicine to know that the chances were good that I'll be okay. But I knew enough about medicine to know that my testicle wasn't supposed to divide into 2 testicles. I had this giant lump on my ball and was like, what the hell is going on? I know this isn't normal. So I went and got checked out, and it all happened very quickly in terms of getting an ultrasound, getting diagnosed, getting set up for surgery. I was at Dartmouth, which is where I went to med school. So I was in New Hampshire. So I was at the hospital system there. And they just moved me through. It was just very quick, within 2 days. I think it was, within definitely less than a week, I was in the operating room having surgery. So it's all happened very quickly.
So you said New Hampshire, you're in Oregon now, right?
Yeah.
Is that where your family is from? I know you were married with a kid.
Yeah. And medicine just takes you all over the place. So, I grew up in Texas, but then I went out to Dartmouth. My wife was actually going to grad school out there. We were dating in college in Texas at the time. And she told me that she was going to go to Dartmouth for grad school. And I was like, oh, that's an easy school to get into. Great. I'll just apply to Dartmouth. And, but eventually they let me in. I just wrote enough letters and annoyed them enough that they accepted me. And then we slowly have moved our way out west because her family lives in Oregon. So that's how we ended up out in Portland. We spent about 5 years, in New Hampshire, and we are not East Coast people. I didn't grow up with snow, and I definitely saw enough of it to last me the rest of my life. So.
Talk to me about when you had your orchiectomy. I mean, how did that kind of the recovery and the surgery, how did that all play into your schedule with, I imagine you were a busy guy at the time.
Yeah. I was, all things considered, it actually came at a pretty good time in my life. I was right at the end of my 3rd year of med school, entering into my 4th year of med school. And I was on a 5-year track. And so I actually had a lot of flexible time to recover, which made it easier. It would have been a lot harder. And it was a lot harder the second time, which I'm sure we'll get to. But the first time around, I was able to have surgery. And, I think I had a full month before I had to do anything. But it's, it's a it's a pretty minimally invasive surgery. You know, the way they do it now, they just make a little inguinal incision, you know, go in, remove it, and you know, you can't use your stomach muscles very well for like, you know, a couple weeks. And so, you know, my wife really enjoyed waiting on me hand and foot and, you know, doing everything I asked. And eventually I had to make it up to her, but you know, she gave me a pass on account of the cancer. So
Yeah, yeah, that's fair. All right. So, as people listening to this may know, you're famous on social media for comedy. So, I read on your website that comedy was not something that was new to you at the time of your diagnosis. You'd been doing it for a while. So, how did that kind of play into how you handled it?
Yeah, I started doing stand up, just amateur stand up, going to open mics down in Houston in high school, actually. And I continued that through college and into med school. And when I got diagnosed, you know, I had spent the first couple of years of med school still doing comedy, making a very tiny amount of money. I think one time I made like $30 and it was a huge deal. It was like the first time I'd gotten paid. It basically just like paid my bar tab. But so I was getting a little bit of success. It was very exciting. But then med school really got in the way of comedy. And so for about a year, I had gone away from doing stand up and I was doing some comedy writing, but wasn't really performing in front of an audience. And then the diagnosis happened. And it was interesting because it was the first time I felt this. I felt this urge to like get back out in front of an audience and talk about this and make jokes. I found myself just writing. I would just start writing material, making fun of the cancer, making fun of the fact that I'm a med student, I had cancer, and I'm I'm in a waiting room with people in their 60s. And, you know, it's just all these little moments that you have in when you get a diagnosis like this, and when you're going to appointments and all these little new experiences that I found so humorous at times. And you know, there's always, you know, I think comedy within tragedy. And so I was writing all this material and I felt that urge to get back out in front of an audience. So I started doing open mics again and talking about the cancer diagnosis. And it helped me to be able to deal with this stress in my life. Really the only way I've ever dealt with stress, which is making jokes about it. And so it just got me back out to performing. Yeah.
That's awesome. Yeah. Comedy was kind of something that I used as well, but not nearly on the level I wasn't doing stand up.
It's, you know, it's scary, to get out there and just try to make an audience of people you've never met before laugh. In fact, you know, now that I have this Glaucomflecken thing, when I go and perform or give talks, it's like the audience knows me. Like they know who I am. They, you know, I've been brought into this conference or event or whatever. And so that's easy. It's whenever you're doing it in front of an audience that has no idea who you are. They've never seen you before, and you got to try to make them laugh, which is what stand-up comics do, especially people just starting out. That's what they do all the time. So I haven't felt that kind of fear and also excitement that to that level in a while, because it's different now. But back when I was doing it as an amateur, it was exciting and also really scary.
All right. So you mentioned you had kind of the medical knowledge when you were diagnosed. You knew it was going to be sort of an easier road than some other illnesses you could have gotten. Were you at all ever concerned about mortality, or you kind of knew that?
You know, I never really was. I really the first time I got cancer, it was a relatively straightforward recovery. And, you know, it was dealing with just the idea that I had cancer, that I am a cancer patient, that was the biggest hurdle for me to overcome that first time. So I never really had thoughts of like, I might die from this. I might, or I'm disfigured or, because it just, that wasn't really a concern for me. It was just that psychological hurdle of, okay, I'm no longer this healthy person who can go and get life insurance anytime they wanted to. Now I have to deal with this.
All right, let's jump ahead. I guess it's about 5 years later.
Mm-hmm.
Were you at
Yeah,
all
4 years? 4 years. Yeah.
Were you at all concerned about recurrence, or I mean, it's a very low
No,
chance.
no, I was not even thinking about that. I had put this really behind me, and I wasn't on any testosterone at that point, and I was still going in like I wasn't really good about keeping up with my surveillance. So it was part of what made that hard is because I was I had moved twice in the past 4 years. And so like reestablishing with an oncologist. And so I wasn't really good at keeping up with the surveillance scans and everything I needed to do, but I was still going, I had an oncologist where I was. And so, but I didn't think about it.
And you were what, stage one
I was
before?
stage one. The first time was stage 1A, seminoma. So it was the best of the best, the best, the best type of testicular cancer you could possibly get. Yeah.
And then the second time, what stage were you?
Second time was stage 1B seminoma.
Okay.
So still very favorable. But that second time, and at this point I was in residency, so much busier. I was entering my final year of residency, looking forward to finally being done with medical education and training and getting my grown-up job in medicine and looking at practices that I would be joining and all this stuff. And then out of the blue, I all of a sudden I feel this lump in my other testicle. It's like, oh, I've been through this, but I know what this is. This is not good. And I tried to convince myself that it was nothing. I was just palpating my epididymis, or you come up with these ways of like trying to rationalize what this abnormality that you're feeling, or but I went in and I actually went in on my lunch break and I didn't think to just take the day off and to go and get diagnosed with cancer. I just did it on my lunch break, which is not a good idea. You should just take the day off if you think you have cancer and get it checked out. But I went in and was very quickly diagnosed with an ultrasound, and that second time around was just much more difficult, because I had a lot of questions I had to answer. Were we done having kids at that point? Because I was now facing the prospect of losing my other testicle, and fortunately we had 2 kids at that point. So do I need to bank sperm? Was hormone replacement therapy going to be like, how much is all this going to cost? Do I need to postpone residencies? Like all these things that I didn't even think about the first time around, but all of a sudden I had to.
Yeah.
Second time.
What age was your first child at this point? Were they aware of what was going on?
Yeah, my oldest at that time was 5, and she knew. My youngest was just barely 1. My oldest, we told him like, daddy's sick, but he's going to get surgery and he's going to be all better, and so we presented it to them in age appropriate ways, and they were fine. That was it was tough. It's tougher the older they get, like when they can really start to understand the nature of things, but they were still pretty young at that point. Yeah.
In regards to some of the questions that you had, like about banking sperm and stuff like that, I mean, let's talk about that. Did you bank sperm, and did you have
I did. Yeah, I did. And let me tell you something. Anybody listening to this, if you are in the position where you need to bank sperm or you want to bank sperm, take the day off from work. Just gonna throw that out there. It's a strange experience. especially as someone who worked in the hospital where I went to bank sperm to like be at your place of work, go and bank sperm, and then go back to work like an hour later. Just a very strange situation I found myself in. But I went in, I did it, and just in case we had decided that we wanted to, have another kid. And then it's an expensive process. It is. It's like I can't remember exactly how much it is, but it's probably, I think it was every 6 months. It was about $500 or something. Mm-hmm. So it's a significant cost to bank sperm. And but we did it probably for about 4 years before we decided, hey, our family's complete. We don't need to do this anymore. And then whenever you get rid of your semen sample, one interesting thing is they make you have a notary. Like you have to have the form notarized to destroy the sample. And so I went to FedEx and met whoever's working there is like, hey, can you help me get rid of my semen sample? Do you mind? Just that's another one, just one of those strange things, that comes with medical care. And there's so many little things like that, right? That you just never thought you'd have to have a conversation about.
Yeah, I had to do something similar. Mine's still in storage, but the clinic where I did mine is closing down, so they're shipping it to somewhere off site. So I had to get a notary, which luckily my aunt is a notary, but she had to sign it and take it in
And
there.
also there's certain things you don't even think about. Like they would ask me, okay, do you want to split this up into 2 different samples to go on 2 different trucks, just in case the first truck drives off a cliff?
Oh my God. No, they didn't
stuff
talk about
like that.
It's
and it would be an extra, $150 to do that. I don't know, I guess.
What happens if they both go off?
Yeah, don't drive off a cliff. I don't know.
All right. What about, you touched on your scheduling. I know that you said earlier it was going to be a little bit more difficult at this point.
Mm-hmm. Yeah. Yeah. It ended up being okay just because it was such an early stage. We had talked about with the urologist doing a testicle sparing surgery. But once I went ahead and went against that because there was a pretty high chance, about a 50-50 chance they'd have to take the rest of it out anyway. And it turns out that would have been the case. So because it was a 1B, there was some lymphatic invasion of the tumor that was the best decision. And recovery was the same as it was, the first time around. It was the testosterone, getting that going, getting insurance to cover it, which is something I'm still, having to deal with, and everybody who's on testosterone has to deal with that, every month. It's technically a controlled substance, so you can't get it you have to get it just at certain intervals. And I know it's a mess. I could go on and on about, the insurance issues with testosterone.
Yeah, I think you're the first one I've talked to on this podcast that's had actually both testicles removed. And so if any insight you could give about the testosterone would be great. And you've got a great beard, so it's not stopping you from growing facial hair.
No, it's I'm doing okay. But what I didn't realize, and I encourage anybody listening, that if you've had one testicle removed, I was told by the urologist, it's fine. You have your remaining testicle will make all the testosterone you need. And so I didn't get my testosterone level checked for a long time. And looking back on it, I think I was low. I think I was low for a long time. I always chalked it up to being in medicine, being a doctor. I'm tired all the time, a little grouchy. But now I'm thinking, now that I've gotten on better versions of it, which I'll talk about in a second, I think I was low. And so I encourage everybody, even if you have one testicle, still ask for your testosterone to be checked just to make sure you're in the normal range. Mm-hmm. And then obviously once I had the other one removed, I had to get on testosterone. So, and I've been on pretty much every single kind that's out there. So I started on the gel androgel or whatever it's called, and I hated that. It's awful. It's greasy. It's, putting it on every day, having to deal with exposure issues.
Where are you
with if
putting
you
it
have
on?
you can put it on anywhere, any exposed skin. Your shoulder. I put it on my shoulder and upper back, and but you can't have you, especially if you have young kids, girls in particular, my wife, you don't want them touching it because you could transfer it to them. And so I had to like not touch anybody or be around them for like 20 minutes after I put it on. And it was really a hassle, but I did that for a few months and just hated it. And it was also fairly expensive to do that. And so I pretty quickly went to injections, which I had been doing probably for about 3 years of weekly injections. And it's cheap. It's the version that the insurance companies want you to do because it's cheap. And so, for a long time, I didn't really think about it. I was like, okay, well, I feel better, having the injections versus the gel, but I was still having lots of mood swings. So this is going for, a couple of years, and, just feeling tired at the end of the week, knowing I could tell when my levels of testosterone were getting low. And it wasn't until about a year ago, I went to a conference, a urology conference, to speak. I was one of the keynote speaker for the conference. So I was talking to all these urologists and I was telling them about my experiences. They're like, what are you doing on these injections? You got to get on, there's so many better options. It's like, really? I haven't even thought about it. And so I started looking into it, and I was on this, so I got established with a urologist in Portland, which I hadn't seen. I just assumed they're the ones that just take the testicle out. They don't, see you for this type of thing. I don't have testicles anymore. Why am I seeing a urologist? But I think they're the perfect people to engage this conversation with and to have manage. I've had an endocrinologist manage my testosterone. I've had a primary care doctor manage it. This is the most comfortable I've felt with somebody managing my levels of testosterone and talking about the different options. And so I should have gone to a urologist a long time ago for it. After talking to my urologist, they got me on first this as a stopgap measure. This version called Xiasted. It's like a subcutaneous one. So it's like a little pen, kind of like an EpiPen kind of thing. It worked out pretty well. But then what I'm on now, actually, it was just today that I got this put in, is something called Testapel, which is it's like one of the newer options where they inject a series of little beads that will slowly release testosterone over 4 to 6 months.
Wow.
Yeah. And it was a pain in the ass getting insurance to cover it too. Like, I can't tell you how many times I had to say, look, I don't make any testosterone. I don't have any. And these other options are not good. And it's a huge, huge pain. And so, it's, the insurance companies, their first instinct is to just reject. Immediately they'll reject like any of these new medications. And then you have to prove to them that they should cover it for you. And it's just kind of the way it is.
Yeah, it's insane. So you are a huge success in social media and in being a doctor and everything. I mean, I think that's important for people to see, that there can be, long, successful, lasting life after a testicular cancer diagnosis, which, because testicular cancer, as we've talked about on this podcast in previous episodes, is mostly a disease of survivors. Do you think that your experiences with testicular cancer, and if you want to talk about your other health scare at all in 2020, do you think that has informed how you treat your patients and then your character online? I'd say, well, one thing it's made me realize was how isolating it is as a young adult
with cancer. And so I got involved in an organization called First Descents, which is they're a nonprofit that supports young adults impacted by cancer. And so it's tied me into that community, which has helped me a lot. But in my career as a physician, as an ophthalmologist, I see mostly people who are older in their 60s, 70s, 80s, 90s. And one thing that's helped me is mostly on the insurance side of things. Now, because I have that experience as a patient, having to deal with our healthcare system, I talk to my patients more about that side of things, and I wasn't doing that before all the problems I've had with my medical issues and dealing with insurance. So I'm more cognizant of that difficulty, and it's a huge, having to deal with insurance is a huge mental and psychological drain on patients. And so it's something that we as physicians should be willing and able to talk about more, because it's a significant stressor in people's lives. And what you're alluding to, the medical issue I had in 2020 was I had a cardiac arrest, totally unrelated. I just have, like, every 4 years I try to die, basically. And my wife is sick of it, I'll tell you. But I had a ventricular fibrillation cardiac arrest. I still don't know why it happened. My heart is otherwise totally fine now. I have a defibrillator, but my wife woke up, heard me gasping for breath, which was a sign of cardiac arrest, and she did chest compressions on me for about 10 minutes and saved my life.
Jeez.
Yeah.
Is that something she does professionally?
No, she's in education. She's in marketing. And so, so she called 911 and they walked her through how to do CPR, and she did it very well her first time around.
Oh my God.
So,
all right. Well, how is this all informed? And, we talked about, you did the stand-up comedy before. You've taken these things that have happened to you and your love for comedy, and made this online character that has made you a huge success. And now you have this platform where you raise awareness of issues like insurance. And last November you did a men's health thing, and that had, almost 2 million views. Talk about that.
Yeah, I think one thing I really like to do with my content is find some of the more overlooked parts of healthcare and the medical field in general. Something that people maybe don't think about or have never heard about, and then shine light on that. And whether it's health insurance or academic publishing or even just conflicts between different specialties within medicine. And one thing I think I'm really good at is boiling down those conflicts or those ideas into content that is accessible to a general audience. And so I think that's why the videos that I make have, and my platform has grown so much, is because it is accessible to people outside of medicine. And so, and it's fun to be able to teach people in a funny and a comedic way about some of these issues in U.S. healthcare in particular, because if you can make someone laugh at a topic, you're going to get much farther reach. People are more likely to share it and show their friends if it's funny, if it makes them laugh. And then the ideas underlying that comedy, obviously travel with it. And so you get more spread of those ideas. Yeah. And so it's fun to do. It's fun to be able to use that platform for a reason other than just making people laugh. Well, a lot of my videos are just, that's all they are. They're just comedy, right? It's just fun to give people a laugh at the end of a hard day in medicine. But then it feels better in some ways to be able to have a message underneath it.
Yeah. I don't remember exactly when it was. It was sometime last year, I think, before at least I knew that you were a testicular cancer survivor. My now fiance at the time of recording, when this comes out, she'll be my wife, was in nursing school, and she just found you organically and has followed you and thinks you're hilarious. So she was excited about this interview.
Awesome.
But yeah, so when you go to these conferences, as you've mentioned, I mean, you were talking about the testosterone and the insurance. Is this something that you're talking with other providers about to kind of, so they kind of see it from your perspective?
Yeah, I frequently will talk to medical audiences about my experience as a patient, because especially some of the more unique things that have happened to me with the cardiac arrest, and then also dealing with insurance from a patient side. Also, with my wife, I've been doing a lot more talks and events, having her come with me, and we talk together because she has a perspective as what you can consider a co-survivor, someone who has experienced all that medical trauma along with me, even though I'm the one that had the medical event happen to. She was right there experiencing all of that as well. And so these are different aspects of healthcare that physicians a lot of times don't personally experience. So I think it's really helpful to just talk about those things in a narrative format, telling my story, getting those conversations started. And so that's a lot of what I've been doing the last, year and a half, whenever I have time to travel for, a couple of days to talk.
That's great. Is that something that they teach in med school? Like kind of, I guess, bedside manner? Is that a class or anything?
Yeah. No, it's certainly developing those like patient physician relationships. But there's just so many things that come with firsthand experience that you're just, unless you experience it, you're not really going to know and be able to connect on a deeper level, either with patients or just, as a human being, unless you've really experienced it.
Yeah. As we wrap this up, do you have any advice for anybody who might have just been diagnosed with testicular cancer and they've searched testicular cancer on Dr. Google and found this podcast?
Well, I mentioned testosterone. So that's one thing that as you go through your recovery, pay attention to that. The physical recovery might be easy, but it's the emotional and mental recovery that can take a little bit longer. And as I mentioned before, cancer when you're young is an isolating, lonely experience at times because you don't see anybody your own age around you. And so what helped me a lot was finding a group, finding that organization I mentioned, First Descents, is one. There's a lot of them though, that really what they do is they help bring young adults impacted by cancer together, to have this shared experience, not just testicular cancer, but just any type of cancer. And that, and really it's just talking to people who have, even though they may have a different type of cancer, a lot of the experiences are the same. People have had chemotherapy, have had surgery, who've had changes to their bodies that you can just hear their experiences and talk about it. And so I think it's really powerful to be able to have a support network of people who have had some of those similar experiences, who are roughly your age. So I encourage people to seek that out. And it's hard to do that. But you can, there's lots of options out there. So using Google, you can find them.
That's great advice. And you mentioned you kind of worked your way west. Are there any providers who you encountered with your testicular cancer journey moving across the country that you want to shout out that anybody listening in those places could find?
Yeah, the oncologist I would say that I spent the most time with was at University of Iowa, where I went to residency. It was Dr. Zachariah, which I think he's still Yusuf Zachariah. And now I'm at Northwest Urology in Portland. And my urologist is Dr. Spettel, Sarah Spettel, which she's done a fantastic job. So it's a great practice. Lots of good doctors there. Yeah.
Cool. Hey, thank you so much for being here. And if you're available next April, I think we'd love to have you at our in-person conference, location TBD, but it'd be awesome if you could make it.
Yeah. Well, thank you for having me. Appreciate it.
Thank you so much, Dr. Will Flanary, aka Dr. Glaucomflecken. Have a great day. For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.